بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. Your Excellency, Dr. Bandar Ginawi, the Chief Executive Officer of the Ministry of National Guard Health Affairs, and the President of King Saud bin Abdulaziz University for Health Sciences. Dear guests, ladies and gentlemen, good afternoon, everyone. What a great day to have you in this special occasion. Let me first introduce myself. My name is Ail Khatami. I'm a stroke and neurology consultant by profession, and I have been working in the corporate quality and patient safety department as an executive director. It is really a great pleasure to welcome you to the World Patient Safety Day. We are very grateful to His Excellency Dr. Bandar Ginawi for this amazing and tremendous support. Dr. Bandar has put patient safety on the top of his agenda, as well as the MNGHA agenda. Thank you, Your Excellency. As you know, healthcare system has become extremely complex. Such complexity makes healthcare prone to errors and subject patients to risk and potential harm. Over the last 2 decades, patient safety continues to be a global public health concern, as unsafe care is one of the top 10 leading causes of death and disability across the world. In a recent WHO data, 1 in 10 patients is harmed during hospital care. MNGHA has recognized this earlier and made remarkable and giant steps to find solutions and implement quality and safety improvement programs. The Quality and Patient Safety Department is now almost 23 or 24 years old. Thankfully, we have experts in quality, risk management, accreditations, and improvement science. The department processes nearly 30,000 SRS every year. It engages with you in hundreds of improvement initiatives across the system with corrective actions and learning culture. And beyond the department, patient safety is integrated in all components of the system to span all processes, all steps of care delivery. It stands in every departmental agenda, and it is a priority for the leaders of our great organization across the entire system. However, organizations may establish departments, buy technology, inject money and resources, but that means nothing without the core and the beating heart of patient safety, which are healthcare providers. Yes, you as healthcare providers are the key component of patient safety. Without your support, without your engagement and dedication, I don't think the organization will reach its goal in providing safe and effective care. Thank you for being a real owner of patient safety. Your openness, your transparency in safety incidents reporting, your commitment to build a learning environment, your inspiration to improve care delivery are truly remarkable. Many thanks and appreciation for MNGHA leadership in supporting just culture, encouraging no shame and no blame rules across the system. Ladies and gentlemen, the best example of your commitment to patient safety was your outstanding response to COVID-19 crisis, despite all risks and the huge challenges we had. Thank you for saving lives. Thank you for taking care of more than 20,000 of COVID-19 patients. We understand how stressful it was. We appreciate the sacrifice and we value your contributions. We understand the risk on your health and well-being, whether it is an infection, accidents, stigma, illness, or death. La samahallah. We also understand that the massive burden on the system had created a stressful environment for you. This may exacerbate risk to your physical and mental health, which may increase the probability of making errors. We believe that your safety as healthcare workers is fundamental for patient safety and a priority for the organization. More than just a priority, it is a value for us. This is why the International Patient Safety Day is all about your safety. And the equation is straightforward for us. Safe health workers, safe patients. We are here today to speak up about your safety and how can we all together, as a front lines, managements, leadership, continue to keep this as a strategic priority. Before I conclude, I would like to thank the team who looked after the organization of this event. In particular, Dr. Yasser Gazzaz, Dr. Abdulaziz Al-Ghamdi, and all the rest of QPS department across the region. I also would like to thank the postgraduate department, media affairs, as well as the KSAU and the ISID department for their support. Finally, I cannot thank you enough. I feel that thank you isn't really enough to express how grateful I am. Now, I will hand over the microphone to His Excellency to endorse the audience. Your Excellency, thank you for being with us, and the stage is yours.
Bismillah ar-Rahman ar-Rahim. Thank you very much, Ali, for this wonderful opening remark. No doubt that what you have mentioned is the heart of the system, and it is the pulse of the whole work around the National Guard Health Affairs. Truly, it is remarkable to be with you today and through this virtual event. Definitely, it's been now a more current practice, but I think it has connected us a little bit more, and I think it gave us a stronger platform to really work together. I want to really thank the team who organized all of this. As you know, this is the second World Patient Safety Day, and clearly the theme this year is the safety of the healthcare workforce. I'm really delighted that we are all working together to ensure that the safety of healthcare workers and healthcare professionals is a priority, and it is something that we should all aim to have. Again, we have used the term protect yourself, protect others, and use the term or the slogan of safety is your responsibility, and as well it is our responsibility. No doubt that the response to COVID-19 has been remarkable by this organization. I want just to remind you all that we have gone through a major performance in our system, specifically in relation to the critical care management of COVID-19 patients at the national level. The Riyadh system, the Jeddah system, Medina, and Al-Hassa has been a major contributor to the success of the national COVID-19 response plan, where the majority of critical care patients in Riyadh specifically has been run by our King Abdulaziz Medical City Riyadh for the city of Riyadh. We had the largest number of patients, as you know, and we were able to do this in a very strong performance, in a way that we were able to improve the outcome of patients, which is again the first priority. Again, a parallel first priority is protecting the system and protecting, of course, the heart of the system, which is the workforce of the system. And we have really brilliantly, we're able to take care of these patients, make sure that they are managed very well, and the highest standard of clinical practice, and as well really support the national healthcare system. So your contribution really to ensuring that the national response to COVID-19, particularly in critical care, has been an exemplary performance. And I think it has shown to the world globally that the Saudi national healthcare system was able to really be collaborative, supportive, and at the same time achieve better results for the care of these patients. No doubt that MERS has really helped the system to be more ready, as well being able to really work collaboratively and cohesively to ensuring that we are really working together. I have been really very happy with and proud at the same time with the way that we have worked together over the last few months. In all the system, in all the regions, to work together. The response, as I said, in Jeddah to the city of Jeddah has been a major force. Your system, the National Guard Health Affairs, the staff of the National Health Affairs has been an important workforce to ensure that we deliver the best for patients with COVID-19. Not only at the bedside, but as well in the different disciplines. The laboratory system, we're able to support the national system with regard to performing testing, and as well ensuring that it is a timely testing, and we've been able to support that very well, specifically in Riyadh and Jeddah. Riyadh has supported the eastern region with regard to testing of their results. Jeddah has supported Medina. So this really nice system, connected, is something that all of us has to be proud of. I think all of us should really look forward to ensuring that we continue to do the same. The disease is not over, and it's going to be there for a while. So please, let's work and continue to work. We should not fatigue. We should not be thinking that it is, and we should not relax our guards. I recently sent a distribution that we need to work together, continuously work together, redesign, innovate, and think proactively in order to maintain vigilance, in order to maintain that we develop the best practices for our patients. No doubt that this issue has brought so much recognition for the National Guard Health Affairs. I hear it on our weekly meeting with the National Committee. I hear it from different groups. The Minister has been really stressing, the Minister of the National Guard, His Royal Highness Prince Abdullah bin Bandar, has been stressing to us and demanding that we really continue to present the system in its best structure, best performance, and as well maintain the right approach towards care of our patients. We have launched so many programs to ensure that we support our staff from all aspects. And please, I sent that distribution to tell you that please tell me how can we help and how can we work together through a specific email that please you can communicate with us directly, and we'll be happy to work together to support the whole system. I hope that you are happy with the management, and I hope that you are happy with the leadership of the system, that it is really we work integratively together. We work as a team, and in order to work as a team, we have to work as a team with the spirit of the team. Again, this is an opportunity. I thought that we need to present together, and we work together, and we talk to each other in a more broader way. I cannot thank you enough, and I hope that the MNHA care for you. We care as a family, and we work as a family. Protecting yourself is as well protecting others, and it is a responsibility for all of us that we work together to ensure that whatever is needed for you to do your job in an effective way, an efficient way, in a safe way is a priority for all of us. Thank you. Ali?
الله وبركاته. وبعد، وتعلمون حفظكم الله ورعاكم ما يعانيه العالم بسبب تفشي جائحة كورونا المستجد. وإذا أشكر كل الجهات الحكومية على جهودها، ونخص العاملين في المجال الصحي.
His Excellency, our CEO, Dr. Bandar Al-Kanawi, asked the nursing services, the directors of the 5 regions, in collaboration with Quality, to come up with this mental well-being group. What we are doing is we are putting in place people on the units that can support our nursing staff. Currently, as an example, in Dammam, we have 3 nurse leaders that go around and interview staff, finding out what the staff members need, what the staff members are struggling with on a daily basis.
Our mission for that is to provide the best quality of care for both patients who have COVID and non-COVID. In the same time, to provide the best safety measures for our healthcare workers and also patients. For that, we increase our work capacity by almost double. Also, we establish dedicated ward for patients who have only COVID-19.
بمناسبة اليوم العالمي لسلامة المرضى، أود أن أشكر جميع الممارسين الصحيين في الشؤون الصحية للحرس الوطني على جهودهم في تقديم الرعاية اللازمة وتفانيهم لضمان سلامة المرضى خلال جائحة كورونا.
بمناسبة اليوم العالمي لسلامة المرضى، أود أن أشكر جميع الممارسين الصحيين والزملاء في الشؤون الصحية بالحرس الوطني على جهودهم في تقديم الرعاية الصحية اللازمة وتفانيهم لضمان سلامة المرضى خلال جائحة كورونا 19. أتمنى السلامة للجميع المرضى.
كان وقت جدا صعب في خلال مسيرتي التدريبية. بنفس الوقت كنت جدا فخور بمشاركة زملائي خدمة مرضى العناية المركزة، وهذا أعطاني دافع أكبر لخدمة المرضى في مختلف الظروف.
خلال فترة الجائحة قدمنا جميع الخدمات للمرضى المصابين بكورونا. قمنا بعمل الولادات الطبيعية والقيصرية للمصابات، اتخذنا جميع الإجراءات اللازمة لذلك. شاركنا جميع الأمهات فرحتهم في الولادة.
مع التنويم والعيادات ومع عدم وجود زيارة ومنع الزيارة للمرضى وأهلهم، كنا في غاية السعادة بتقديم الدعم النفسي والاجتماعي للمرضى وأهلهم، وذلك عن طريق إيصالهم بالاتصال المرئي والغير مرئي بأهلهم.
بمناسبة اليوم العالمي لسلامة المرضى، أود أن أشكر جميع الزملاء والزميلات الممارسين الصحيين في الشؤون الصحية بوزارة الحرس الوطني على جهودهم في تقديم الرعاية اللازمة وتفانيهم لضمان سلامة المرضى خلال جائحة كورونا.
بمناسبة اليوم العالمي لسلامة المرضى، أود أن أشكر جميع الزملاء والزميلات الممارسين الصحيين في الشؤون الصحية بوزارة الحرس الوطني على جهودهم في تقديم الرعاية اللازمة وتفانيهم لضمان سلامة المرضى خلال جائحة كورونا.
بمناسبة اليوم العالمي لسلامة المرضى، أود أن أقدم شكري لجميع الزملاء في الشؤون الصحية على تقديم الرعاية اللازمة وتفانيهم لضمان سلامة المرضى خلال جائحة كورونا.
نظرا لطبيعة عملنا وتعاملنا المستمر مع أجهزة التنفس الصناعي للمصابين خلال الجائحة، واجهنا الكثير من اللحظات الصعبة،
واخترنا رغم ذلك خدمة مرضانا، تشافيهم وخروجهم من العناية مصدر طاقة متجدد للعودة إلى العمل مرة أخرى.
We are proud to be a part of the COVID-19 team, keeping patients and healthcare workers safe.
In response to the large number of patients with COVID-19 who presented to the intensive care unit, it was critical for us to maintain the high quality of care, but at the same time, maintain the safety of our healthcare workers.
As we all know, in March 2020, the WHO declared the COVID-19 as a pandemic. Yet earlier that year, nursing services took the lead to ensure that we are ready, that the staff are ready, the organization are ready. So we worked on high-level strategies to ensure that our nurses are safe and our patients are also safe, plus the organization is prepared to face that pandemic.
2020 will probably be remembered as one of the most testing periods in recent healthcare history. The current COVID pandemic has presented some unique challenges, and Patient Safety Week pays tribute to this. Our CASH teams have worked diligently to maintain patient and staff safety.
بمناسبة اليوم العالمي لسلامة المرضى، أود أن أشكر جميع الزملاء والزميلات من الممارسين الصحيين والإداريين في الشؤون الصحية بالحرس الوطني على جهودهم وتفانيهم في تقديم الرعاية اللازمة خلال جائحة كورونا.
مما هو معلوم، برنامج الطب الوقائي ومكافحة العدوى من البرامج الأساسية لضمان سلامة المرضى، يعتمد بشكل كبير بمنع أو تقليل حدوث العدوى بين الممارسين الصحيين بينهم بين، أو بين المرضى بينهم بين، أو بين المرضى والممارسين الصحيين، وضمان وجود بيئة صحية داخل المستشفيات والمنشآت الصحية، مما يضمن استمرار تقديم الخدمات الطبية الأخرى.
أشكر جميع الزملاء من الممارسين الصحيين في الشؤون الصحية بوزارة الحرس الوطني على الجهد المبذول في تقديم الرعاية الصحية المتميزة للمرضى، مع وضع سلامة المرضى هدفا أساسيا خلال جائحة كورونا.
بمناسبة اليوم العالمي لسلامة المرضى، أحب أشكر جميع الزملاء والزميلات في الشؤون الصحية بوزارة الحرس الوطني على المجهودات الفعالة اللي قدموها في التصدي لجائحة فيروس كورونا المستجد.
عيادتنا احتوت تبعات تحويل المستشفى لمركز رعاية مرضى كوفيد، واستوعبنا الأعداد المتزايدة من المراجعين مع ازدياد في صعوبة الحالات، وقد فتحنا قنوات التواصل مع المرضى وفرزهم لتقليل الازدحام في المراكز الطبية.
الجائحة غيرت الخدمات المقدمة كماً وكيفاً، وجب علينا التوسع وإيجاد الحلول لأقسام العزل مع الاستعانة بالأقسام الأخرى لاستيعاب أعداد المرضى المصابين المتزايد.
المحافظة على حياة المرضى خارج نطاق المستشفى
مع نقلهم بسرعة وسلامة هي مهمتنا الأساسية. خلال الجائحة تشرفنا بخدمة المصابين وإسعافهم وإعادة لم شملهم بأهاليهم.
بسم الله الرحمن الرحيم. بمناسبة اليوم العالمي لسلامة المرضى، أود أن أشكر جميع الممارسين الصحيين والإداريين في الشؤون الصحية بوزارة الحرس الوطني على جهودهم في تقديم الرعاية اللازمة وتفانيهم لضمان سلامة المرضى خلال جائحة كورونا.
بسم الله الرحمن الرحيم. بمناسبة اليوم العالمي لسلامة المرضى، أود أن أشكر جميع الممارسين الصحيين والزملاء في الشؤون الصحية بوزارة الحرس الوطني على جهودهم المتميزة بتقديم أعلى معايير الرعاية الصحية وتفانيهم لضمان سلامة المرضى خلال جائحة كورونا.
وهنا أوجه الشكر والتقدير لكل الممارسين الصحيين ومقدمي الرعاية وكل من ساهم وشارك في هذه الأزمة نظير جهودهم التي يقومون بها من أجل الوطن في سبيل الحفاظ على رعاية صحية آمنة.
يوم الخميس الموافق 17 سبتمبر 2020 سيوافق اليوم العالمي لسلامة المرضى، وبيكون المشهد الرئيسي والفعاليات المصاحبة تتعلق بهذه الجزئية وهي سلامة الممارس الصحي. طبعا هذا العام بشكل استثنائي دائما نتذكر الجهود الكبيرة التي بذلها الممارس الصحي.
Great. We're back. Thank you, Your Excellency, for this inspiring speech. And thank you for the group for preparing this summary of what has been going for a while in the different regions. When we look into these achievements and this responsiveness, massive responsiveness, I feel so proud of being part of this system. Over the next hour or so, I am honored to welcome and introduce two eminent speakers, two of our leaders. First, Dr. Abdel Mohsen Al-Saawi. Abdel Mohsen Al-Saawi is an emergency consultant. He has an extensive experience in quality and patient safety. He was the ex-executive director of quality and patient safety, and currently he is the executive director of medical services Central Region. Dr. Abdel Mohsen Al-Saawi has a great experience in improvement science and leading quality and patient safety across the system and across the nation as well. He has multiple contributions, and over the next half an hour, we will talk together about enhancement of patient safety through building a just culture and safe culture as well. At the same time, I would like also to welcome our great surgeon, Dr. Mohammed Zahrani. Dr. Mohammed Zahrani is a consultant oncology and endocrine surgeon. He early in his career, he served in quality and patient safety as well. And then he left us here in Riyadh and moved to Jeddah, and he's currently the executive director of medical services in Western region. Welcome both. We will reflect together on many things, and Dr. Mohammed Zahrani will reflect and focus on our experience and lessons learned throughout this journey. I wish that you will enjoy it, and we'll start with Dr. Abdel Mohsen Al-Saawi. Dr. Abdel Mohsen, as you know, patient safety is now a a cornerstone of any healthcare system. There is a growing evidence supporting the relationship between patient safety as well as just culture. Can you please highlight this importance link and explain to us before that, what do we mean by just and safe culture?
شكرا جزيلا دكتور علي، مساكم الله بالخير جميعا الحضور معنا اليوم، وبالإضافة للدكتور محمد مساك الله بالخير. Thank you for the question دكتور علي. طبعا يعني I will start with saying that the National Guard Health Affairs has chosen safety and the culture of safety as one of its primary targets. So it is the ultimate target of the organization. And these initiatives have started early on. Yani, I would say more than a decade ago. The vision and the direction was clear towards the culture of safety. During that evolution, and exactly around 2015, 2016, looking at our culture and our learnings, it was apparent that we need to address the just culture component, which deals mainly with the way that you look at individuals and the way that they contribute into your safety. And this is where the just culture thinking and just culture algorithms and just culture policy get introduced into the system. So it's an integral part to achieve a safe culture is to have a just culture. And we'll go into that in more details during the discussion. But basically, the main difference between just culture and I mean, the main principle of just culture is that when you have potential incidents, be it there is a harm or no harm, you don't look at the outcome of the incident per se, but you look at the behavior of the individuals who were involved in that incident. So let's say that you mentioned Dr. Mohammed Zahrani and being a great surgeon and a quality advocate when he was here in the central region. The issue of timeout was a very common issue. So in a safe culture, you will address the importance of timeout, and if a surgeon, for example, refuses to do the timeout properly, even if there is no harm, even if there is no bad outcome that happened to patients, that behavior by itself should go under just culture algorithm, and disciplinary actions could be taken, even though there is no harm and no one was harmed throughout the process. On the other side, let's say that there was an actual harm incident, but looking at the behavior, everybody did his best within the capacities and the capabilities and the processes of the system. Here you would look at how do you build a system that prevent people from doing harm. So that is the point of culture, or just culture, is looking at the behaviors and reflecting on the accountability of individuals based on that behavior. I hope this addresses the question.
Wonderful, thank you. So can you, Dr. Sawi, can you highlight our experience over the last several years with just culture? How did the system invest in this area?
Okay, so allow me to share a few slides, and please let me know if it appears, لأنه I'm always يعني speaking without the slides and I get notified minutes later. The question was about the journey of the system with the culture measurement. So I would say that first, the system has set out to proactively manage culture. Not only measure culture, some systems measure culture only, but our system has decided that it would proactively manage culture. I don't know why the slide keeps changing. So starting early on the journey of the system, from about 2014, there was the first
culture measurement that was done system-wide, and we do culture measurements in a very unique way, different than any other system in the region, where we contract with a third party to make sure that staff would feel comfortable expressing their own perspectives of cultures within their units. In addition, we get unbiased assessment. The journey
you are at the slide. You are at the slide 2. Are you changing your slides just to make sure that we're in the correct slide? Okay, we get slide 3.
Okay, so this is the slide that shows the journey of the system, right, from 2014 to 2019. صحيح أبو فهد?
Yes.
Okay, so and the measurement is system-wide. So Riyadh measures in the same way as Jeddah does, as the primary healthcare site in Rafah or Hail or the dialysis center in Mecca. Everybody measures culture in the same way, and results are reflected at the specific unit level, so that you can better manage culture at the micro level. So that's how the system has approached culture consistently over the past more than 6 years currently, and proactively. And this has led to tremendous improvement and tremendous opportunities that are identified throughout this journey. Back to you, Abu Fahad.
Beautiful. Have we seen an impact, Abu Abdurrahman, on the system, on the rate of reporting, on the do we have an evidence that this worked?
طبعا the literature is vast in terms of evidence that culture impacts safety in different industries. You can start with the airline industry, ولكن in the healthcare industry, the evidence is massive that culture improves safety, and culture is local. The culture in Riyadh may be different than Jeddah, but the culture in Clinic 101 may be different than the culture in Clinic 102. So culture is very local to the settings. And the graph here depicts the units at the micro level. So these are OR rooms, emergency department units, clinics, each separated across the spectrum of teamwork climates and safety climates, which are two major critical components of culture. And you can see that units at the top have the lowest risk because they have the safest component when it comes to culture, comparing it to the highest risk units at the far end of the bottom of the graph. And being at the quality or from a quality and patient safety perspective, if you would correlate the harm incidents, if you would correlate the patient complaints, it would very beautifully and linearly correlate with those culture results. So I ask everyone, be it at the hospital level, be it at the even the clinic level, if your clinic is one of your clinics, is one of the down at the bottom of the left of the screen there, you would find that patients there are not satisfied, staff there are not satisfied, complaints are higher, maybe harm incidents are higher as compared to units that are in the top. And that's the best evidence locally that culture matters and culture has a direct impact on safety. Back to you, Fahad.
Beautiful. So we're reporting and processing more than 30,000 of SRS every year across the system. What does that mean for us as healthcare workers, for patients, and for the system?
So allow me to go to a different slide, Abu Fahad, and this slide has to do with reporting. Many systems struggle with reporting, and that staff do not report, and they wonder why is that. I would say that we're one of the top organizations when it comes to encouraging reporting and rewarding reporters. And we do that annually across different regions, different hospitals in the system. And the increase in the number of reports is regular. And we actually look at it as a positive thing because we want people to flag issues and address issues as they go. And there is a system, there is a delicate balance here. So if the culture is not safe, if staff would be pointed at, if they report something, they wouldn't report. So you need a safe culture as a foundation of a healthy reporting and learning system. Having a safe culture is not enough. You need also a robust reporting system. I'm not sure if people remember here the OVAs that we used to have more than a decade ago. And it is extremely hard to get out numbers or trends or identify issues. Now you have a robust reporting system that enables this process. In addition, there has been action based on these reports. Otherwise, people would feel that it is meaningless if I continue reporting without seeing any action happen. So the continuous improvement cycle should go on. And there is a leadership commitment. And here I don't speak only about top organizational leadership. I speak about leadership at the unit level. So most of the units that have addressed their safety culture and reporting culture rightly, these are units that manage their own safety reports and deal with their own safety reports as their own problems. And it is, because unless you address these proactively, these are going to come at you later as complaints or as harm incidents. So it's ideal that those reports are managed first at the unit level, and leadership at the unit level is very important for that aspect. Back to you.
Wonderful, Abu Abdurrahman. I think we have almost 2,000 people watching us. And I'm sure there are a lot of managers, supervisors, and units directors who are watching us. If I am a manager or supervisor on a small unit, and I want to go back into my unit and I wanted to assess a culture, and the culture in the unit, or the safe culture in the unit, or I wanted to implement something, how can I do that? And what are the resources available for me in the organization to build such culture?
Okay, so I'll try to give you and this will be my summarizing slide. And I will not say go to quality and they will teach you culture, but they're available as a resource, I'm sure, in every region and every hospital. I still love them. Let me take you to my summary slide. If you're a leader at a specific unit level, or a director, or a manager, or a chairman, or an executive director, this is a simple depiction of what a safe culture means and how do you fit into that culture. So everyone has to understand that safety is the first priority. And if I'm an employee and my manager doesn't care about safety, I will consider the culture as unsafe, because my manager is asking me for things that are unsafe. So everybody has to agree on the system that culture, that safety is everyone's target and everyone's goal, and there is no compromise in safety. And this is clear from the bottom, from the top of the organization, and it has to be clear all across the organization that culture is everyone's responsibility and everyone's goal. The second issue is that everyone in that unit or in your unit should be able to verbalize their concerns, escalate their concerns, and encourage to report if there are issues that needs to be reported. So no one should be blamed for reporting or voicing their concerns. Otherwise, you're killing the culture of safety at that unit level. In addition, the third point is really important. We alluded to it in the Just Culture discussion, that there is a simple model of accountability. There has to be a component of accountability. So let's say that individual who refuses consistently to do timeout, if the system does not hold that individual accountable, then this will be harmful to the perception of other people regarding safety culture. So there has to be a model of accountability. And I reflect here, when the Just Culture policy was created in 2016, implementation was quite difficult. The addition that I believe should help in introducing this concept further and implementing it further within the system is that Just Culture algorithm is currently introduced and implemented in the safety reporting system. So if I'm a manager and I receive a report today that يعني أنا آسف I'm sorry Dr. زهراني ولكن let's say I received the report today that you refused to do timeout today in the OR, or you refused to do the double verification process for a patient, for example. So I would reflect on that just culture algorithm during my analysis on the safety reporting system. And the system would ask me, or the process would ask me, was that individual impaired, for example? No. Was that individual, it will ask you about the three basic questions in regards to accountability. First, at one end of the spectrum, was it a simple error? And at the other extreme of the spectrum, was it at-risk behavior or a risky behavior, or was it negligence? And depending on what that person what was the behavior at that point, we would go to the final step of the just culture accountability algorithm, is doing the substitution test. So let's say that Dr. Muhammad, I'm sorry, like let's say that a surgeon refused to do timeout. And when we looked at when we reviewed the incident, we felt that this is at-risk behavior. Before we say that there is accountability here, we would do the substitution test. What would an individual with a similar experience, similar background, and the similar scenario do? Would it be the same? If it isn't, then we will apply the accountability system and we hold that individual accountable to their behavior. Fourth, there would be a continuous process of identification and mitigation of risk. So people would not get lax and say, you know, this has been there all the time. We know that it is an area of risk. We reported it, but nobody did anything, so we ignored it. There is a continuous focus on addressing all areas of risk and mitigating them or eliminating them. When someone reports or voices their concern, instead of being shut down, we actually respect them, encourage them, and thank them. And most importantly, for a leadership perspective, if someone comes to their unit manager or their leader with a concern, the leader takes it, thanks them, addresses that concern. It's very important that the loop is closed. So going back to that individual and telling them, thank you, this issue has been addressed, and now this risk is gone, it has a major impact on the perception of frontline staff in regards to the safety culture within their unit and their hospital. Back to you, Abu Fahad.
Amazing, Abu Abdurrahman. Now, in continuation to what you have said, and this question is for you as well as for Dr. Zahrani, is that where do you strike the balance? How do you draw the line between accountability versus non-punitive, no blame, no shame rules? Would really pushing the just culture too much be on the expense of accountability?
Of course, I will leave it to Dr. Muhammad, ولكن of course it's important to go through that accountability and just culture algorithm that is available in the just culture policy appendix B, I think. I still remember my quality days, by the way. And so reflecting on that in all the scenarios that you consider individual accountability. And that algorithm will guide you through the process if there is an individual accountability or not. We even ask committees that review medical practice, review morbidities and mortalities to consider the same algorithm during the analysis. And that algorithm should help us objectively decide if there is an individual accountability component or it is a system issues that we need to address similar to the Swiss cheese model.
Dr. Zahrani, can you comment on this?
Sure. بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته جميعا.
السلام.
Let me first, Dr. Ali, to first thank His Excellency Dr. Bender Al-Ganawi for the demonstration of great leadership model and the support to all the regions and all disciplines and units across the board. Secondly, I'd like to thank you, Dr. Ali, personally for the huge effort that you're doing and adding to the value of the system. Thanking as well the team and the organizing committee for the beautiful really conduct of the World Patient Safety Day. That really gave an important flavor to the meeting this year, especially that we're all living through the challenges of the COVID pandemic. But also it gave us the flavor of being really connected together. Probably this platform with this virtual crowd is unprecedented. And that's one of the blessings and the lessons that we've learned through the COVID pandemic, that we are really connected more than what we imagine, and the transfer of knowledge and skills and experiences is quite important for the organization. Back to the point of just culture, beautiful review of Dr. Abdel Mohsen Sawi. Thank you very much. Although telling 2,000 people that Dr. Zahrani is not doing the checklist does not make him great anymore. But I'm sure they understand that this is just for the sake of demonstration of the example. I'll talk about the just culture in healthcare. The concept of safety and just culture in healthcare is one of the lagging point in healthcare system across the globe. And the reason is very simple, is just because all well-developed business models have adopted and developed their just cultures and safety profiles early on, talking about 30 to 40 years ago. The healthcare system continued to lag behind just because people running and conducting healthcare systems are, did not adopt, did not embrace the concept that healthcare is a business model. So it continued to be perceived as a traditional patient-doctor relationship, without a lot of monitoring and auditing tools for improvement. And that's why I think there is still struggle in the healthcare systems across the globe to set the fine strike between just culture and no blame. If you go back in 1994, where the famous paper that was published in JAMA in 1994, talking about the errors in medicine, it's already quoted like 4,000 times. 6 years later, the Institute of Medicine published To Err as Human paper, which is quoted like more than 22,000 times. That was actually the kick-off of trying to embrace the system business models and injecting safety and just culture models. But I agree with Dr. Abdel Mohsen that no blame was the beginning of the theme that actually has resulted in inadequate addressing of the points. And that's why shifting gears to just culture is the way to go right now, where the system is accountable and individuals are accountable according to the policies and procedures, where the aim and the theme is not actually to pinpoint fingers to individual errors, but actually to turn it into an educational opportunity to learn from it and to enhance the system. Advocating, speaking up for safety, for issues related to patient safety or provider safety is the way to go. And I think this is an evolving process.
Beautiful. Now I have a couple of questions. Actually, we have a lot of questions from the audience, but we'll try to pick some that are related directly to the two topics. One is to Dr. Abdel Mohsen. How can we make sure that when I, as employee, report something, it doesn't fire back at me? And whether anonymous reporting had added a value?
Thank you, Abu Fahad. طبعا the system protects reporters, and this is introduced into the just culture policy. It's introduced into the employee relations manual, and I've been in this process over the past 5 or 6 years in terms of quality and patient safety, and no one has been punished or made to suffer because of their reporting. In addition to the newly established process of anonymous reporting. Anonymous reporting, طبعا I haven't gotten the chance to observe how it evolves. And I left quality when that was established, so I'm not sure about the impact it had on reporting behavior. But as it was always being mentioned as a barrier sometimes in reporting, so that's an option that that will address any concerns that relates to the risks of reporting in case if the culture in a unit is not safe to do so.
Great. So let me ask Dr. Zahrani. We have a question here from one of the audience. Having a policy, writing up a DPP or APP, giving a presentation about just culture and non-punitive culture doesn't mean that we practicing it on the unit level. How do we really make sure that we monitor implementation of our APPs, DPPs at frontline clinical areas and non-clinical areas as well?
Thank you, Abu Fahad, and thanks for the great question. I think this is the crux of the story: how to really make sure that the just culture is embedded into the DNA of the organization. The great efforts that have been made and the great mileage that we've gained in MNGHA, and everybody now, realizes very well that MNGHA is the spearhead of safety advocacy in healthcare. Through the wide spectrum of activities and initiatives that are regional and even international. And the whole idea of this is to try to bring this issue always into the consciousness of every healthcare provider or hospital employee across the regions. DPPs is very important. Putting the bylaws and policies is very, very important. Implementation can be the challenging aspect of it. This can be eased up by a number of ways. Most importantly is every business unit manager or director should create the right atmosphere for people to feel that there is an atmosphere of trust. And trust means that if I feel vulnerable, then this is not going to be taken against my advantage. And this actually is going to be used for constructive feedbacks and trying to learn together and try to enhance the process of safety and just culture. Part of it is sharing data. It is very, very important that if we share data, whatever data we're talking about, data of safety, data of harm, data of performance, different KPIs, just the mere fact that you're sharing numbers with your own people in the unit, it definitely is going to leverage the motivation and engagement of all your staff, and will encourage them to be part of the solution and to give some innovative ideas. So encouraging people to speak up and to share the data. Actually, there is a paper that was published by Medical Journal of Medicine, by British Medical Journal, I'm sorry, that actually looked at just the fact of displaying data in different units, and they found out the quality, the safety, the just culture has improved automatically just by showing numbers. So I think these measures needs, we should not underestimate the fact of reaching out to our own people, encouraging them to speak up and also share the data and make them own the data and own the business, play with the data and come up with initiatives to enhance the culture and safety.
Wonderful. Both of you are medical directors, and both of you had a great background in quality and patient safety. How do you see the future of just culture and MNGHA? Dr. Sawi?
That's a wonderful question, Abu Fahad, and it has to do with multiple dimensions. So the first dimension, I think, is the strategy. So the organization has set it clearly that the strategy is to keep enforcing that culture of safety as the foundations of the system, and even beyond the system walls. Even the national healthcare transformation, which is part of the 2030 vision, has set one of its 20 objectives. So it has around 15 to 20 objectives in healthcare, and one of those objectives is a safe culture. And even there's a numeric target for the 2020 safety culture and the 2030 safety culture. So it is a national priority. It isn't only an organizational priority. So from a strategic perspective, that is well and good. I see us reaching that direction if we own culture measurement, culture management, and culture improvement at the unit specific level. I want the clinic director, I want the clinic MRP, I want the nurse manager in that ward to come and ask for their culture results, the issues that were reported in their culture scores, to proactively manage the safety reporting system processes in their units. And here I would like to reflect on two great examples that we have in the system. For example, I will mention the neonatal intensive care department and the oncology department, who has proactively managed to share their safety reporting system outcomes, action plans, trends with their department front lines every month. And that should help enforce the culture of reporting, enforce the culture of continuous improvement. So taking that ownership down to the unit level, department level, even clinical team level is the way to go in order for us to reach the national and organizational targets and keep our patients safe.
Wonderful. Dr. Zahrani, do you think having the measurements and monitoring of just culture at the unit level should be one of the vital signs of the organization?
Thank you, Dr. Ali. I think this is a very essential question we need to all work together to address. Besides what Abdurrahman has mentioned, I think going forward with creating a robust just culture is a priority for the organization. And I think if there is any organization that's more likely to succeed in achieving the right mileage in that, it is going to be MNGHA, given all the excellent credit history that it has built in safety and just culture. I think, the trick here is to try to create some measurements for culture, because we all know that if you can't measure it, you can't improve it. However, creating measures, direct surrogates for the culture can be really difficult. But through indirect surrogates, we can definitely gauge the level of just culture, the level of safety, the level of transparency. One of the examples is the pulse survey that we send every now and then, and that can give you some aspect of it, although, if it's not well balanced across the units and across all the career pathways, it can give you some skewed insights. So working on developing some KPIs that are indirectly related to the culture is the way to go. Sharing those KPIs regularly in mandated reports by different business units of the healthcare system, and trying to address it across the board of the ladder, from the senior management down to middle management down, even to the small units. And I think with this collectively, we will definitely achieve a good mileage in creating the culture.
We have received tons of questions, great thoughts and ideas, suggestions, and inquiries from the audience, and I wish that we can answer all of them and go through them. Unfortunately, due to the time, we will move into Dr. Zahrani reflection on our experience in MNGHA on COVID-19 response. And then hopefully, if we have enough time at the end, we can go back to the questions and try to answer them. Dr. Zahrani, Dr. Abdul Mahsen, please stay with us. Dr. Zahrani will walk through our experience and then we'll reflect on it together.
Looking forward.
Thank you, Dr. Ali. It's actually my honor to present some of the reflections and the lessons that the system of UNGHA has learned through the COVID pandemic. And presenting it gives me a privilege and honor, but also it can be challenging because definitely there are so many lessons out there that have been gained by all people working in the organization. So I would like to thank all attendees and all MGHA employees for allowing me to give some reflections on that. Allow me to share some of the slides that I have here. And tell me if you can see the slides, please.
We'll get them.
Okay. So this shows a full screen, right?
Yes.
All right. So before I actually jump in the learning lessons out of the COVID pandemic, I would like to give this disclosure that all achievements and success stories are created by all and therefore can only be sustained by all. There is no experience that is created by one individual or a success story that has been crafted by one individual. All the teams, all the members of the working workforce in MGHA, take the credit of every achievement and every success story across the board and across the regions, and that's a very important concept here. Secondly, lessons are endless and diverse. Again, across units, across levels of experience, across individuals, and it's impossible to cover all the learning lessons. But we'll just give a snapshot of and touch base with some main lessons that we've learned. I think very important ones through the COVID pandemic, and I'm trying to blunt any regional flavor. So if you feel that there is a regional flavor here, it is not intended to be, and it definitely extends to all regions, even if you feel that there is a regional flavor here. Looking backwards from January onward, the crisis has been huge, and the impact of this crisis has been as well huge. And looking at how many people have passed away in 8 months, approaching 1 million, and 30 million COVID-19 cases were diagnosed. This is huge, and the impact is across the board in all disciplines. Look at the level of unemployment that has jumped multiple folds in different countries. Look at the stock market and the economy that has actually crashed during some time of the first quarter of the year. So this huge impact, with it comes a huge learning opportunity. And we're here to give some reflections on that. Abu Fahd, shall I continue, or you want to ask a question?
No, go ahead, please.
Okay. So looking at the previous 5 years from 2015 and 2020, we all know being through the MERS-CoV. So did we learn out of MERS-CoV anything as a system? Just sharing some of the numbers will tell us that we had achieved a lot of learning down the road, even if we don't feel all the soft skills that the organization has gained between MERS-CoV and COVID-19. If you look at the numbers, for example, number of cases between MERS-CoV in 2015 and COVID-19 in 2020, the number is actually 1,000 times higher in 2020. Despite this, system interruption did not actually happen anywhere in MGHA. If you look back in 2015, there was some bottlenecks that has led to a major adverse impact on the healthcare system. But despite that, we have all this number of cases, the system remained functional to its fullest capacity. That's on its own is a reflection of a huge learning and a huge resilience of the system that has been gained. The last observation here is that healthcare workers infected. We know how effective COVID-19 is compared to MERS-CoV. And we know now that 1,000 times the number of that happened in 2020. Despite this, the healthcare worker number of infections that were encountered is only 1/3 of those in 2015. That speaks for how much learning that took place, whether we feel it or not. So, looking at a snapshot at any healthcare organization, what really makes an organization successful, especially during exceptional times? I can talk about three main components that has to be blended in a nice blend in order to translate into a successful healthcare system. Number one is capacity. Number two is safety, which is central as well, and then efficiency of the system. If you look at the capacity, traditionally we talk about the trained staff, you have trained staff, and infrastructure, which is space and equipment and technologies and all required logistic installments in the system. But also there is soft organization skills. And I think that is a game changing. And that's what happened in 2015 versus 2020, that the soft organization skills have been gained down the road that actually translated into more efficient system. So that's very, very important for the system. Number two, efficiency. Efficiency, you talk about resourcefulness. Resourcefulness, you have a lot of resources. However, these resources are finite. No matter how much stress you put on the system, there is going to be a cap in the system that you can't really exceed. So appropriate utilization of resources is a key in order to maintain and sustain the efficiency. Number two is the customer-centered approach. We have to think of how to allocate the resources and mobilize and align resources that would meet the demands and the expectations of the customer, so that there will be an appropriate allocation of resources and choosing wisely here. Safety definitely is a central component. And when we talk about safety, you talk about safety of the patient, safety of the healthcare workers, safety of other employees, and safety of the assets. You talk about premises, equipment, and everything that is owned by the system. So with the constellation of all these ideas and thoughts and working on them in parallel, you would ensure that your healthcare system is going to fly smoothly, especially during exceptional times. And that takes me to the first lesson that we've gained between MERS-CoV and COVID-19. And this is a quote from Anthony Fauci, who is very well known, US leader in infection control and immunology. And he is the director of the National Institute of Infectious Disease in the United States. He says that when you're experiencing an outbreak, don't ever underestimate the potential of the pandemic. And I think that proved very true, looking at what happened in the healthcare system in Europe and in America versus what happened in other systems like our national system. A little story here. If you know the whistleblower who was a Chinese physician, he was actually an ophthalmologist. His name is Li Wenliang. And again, this speaks for the just culture and speaking up. He actually spread the concerns about SARS-like illness 3 weeks before the official announcement of having a new infection that's cooking in China. And because of this spread of the news, he was detained for false allegations. 3 weeks later, the system identified that this is true and measures have to be taken in order to address it and contain it. The physician unfortunately died at 33 of age on the 7th of April 2020 of COVID-19. So that brings you to the the core of the lesson, which is moving fast, being receptive to whistleblower, like what happened in China. This is a paper that was published in Southampton in UK that tried to predict through some mathematical models if measures, non-pharmaceutical interventions for containing COVID outbreak in China took place immediately in synchronizing with the spread of the concerns of this physician. And they ran that mathematical models. Surprisingly, they found out that 95% in China cases would have been cut by acting 3 weeks earlier. So this cannot be overemphasized, that we have to be really on top of the game without undue delay. Zoom in to MNGHA very early on, before actually we had cases. And as per the directives of His Excellency Dr. Bandar Ganawi, in the hack meeting that took place late February or early March, it was very clear that we need to be proactive, we need to develop our plans, we need to test our system, we need to look into our preparedness and allocate the resources in order to be on top of the game when the pandemic actually starts hitting. And that's what happened. What was done basically is we started with the directive of the CEO and spearheaded by the Infection Prevention Control with the Emerging Pathogen Preparedness Committee. That was the regional platform that meets regularly and then addresses the issues of preparedness and day-to-day operations of the region. We realized soon that the Emerging Pathogen Preparedness Committee needs to really assign groups of experts across the disciplines to address the different components of the plan. So we had created the Infrastructure Capacity Committee that looks into what is the capacity existing, what are the potential capacity that we can create, whether inside KMC or even outside KMC, how we can address the isolation capacity, the critical care in terms of space, in terms of the setup, the ventilators, all the logistic, and also the COVID testing capacity in order to maximize it to meet the expected demand. That's one. Staffing. We realize that also we need to look into the staffing, especially if we activate the mode of disaster and upsurge capacity, that healthcare workers and other supportive staff need to be on board, and we need to have adequate coverage. And that was also one of the main functions. The other committee was looking into the training, because we know that the healthcare system globally and also nationally was little exposed in some of the areas, given the COVID pandemic, and given that critical care, for example, is a needed area that needs to be supported very well by the system. That training is a game-changing step in order to train people to do the necessary basic work in critical care, RTs, nurses cross-training for critical care. So that was another core task. Volunteering services. Again, the partnership with the community, and opening and maximizing and having a system approach towards the volunteering services, which is also a national mandate, and that was also directed by a royal decree. It was thought that volunteering can be really of a good support to the system during the pandemic. And through that committee, some registry database was created, online application form and processes, etc. Science is very important here. So especially with the ambiguity of the science at the beginning, and having some of the papers that were published and retained and retracted, scientific committee was very, very important to guide the system with the best possible up-to-date scientific data that will guide the system to navigate smoothly during the COVID. In parallel, the Disaster Preparedness Committee that crafted a region-wide DPP. And again, these initiatives, I'm sure they're across the regions, and every region's doing the same, probably different details, but the overall concept is basically the same. So Disaster Preparedness Committee worked on that and created all the necessary action plans. So that's one of the lessons. having all these committees, all these teams working day and night from different disciplines, it's not easy. It can be very difficult and it can be very hard, but it is very vital and very essential to make decisions in response to daily dynamics and moving targets. There might be some degree of uncertainty. There are so many stakeholders in every business that the system is trying to achieve. And here comes the importance of coordination. Day and night, conversations sometimes are needed in order to resolve urgent issues. And without doing this step, things can be really difficult. One of the components of this coordination that proved very successful, and there is a wealth of literature that supports this, is having daily huddles. Daily huddles is very, very important to address issues as they resolve, to provide adequate information for people to have the right insights, and to try to come to common grounds of what goals we're trying to achieve, whether short or long-term goals, and to move in alignment. Now, so the theme here is flying a plane without being built. There are so many moving targets and so many issues, and a level of uncertainty is on board. Now, if you go to the basic concept of any healthcare system, you talk about the demand capacity issue, whether you talk about space or you talk about manpower or technical capability. In the demand, you have an ongoing emergency demand, whatever service you're talking about, ongoing elective demand, and there's always a wait list pool, because if the system is really great, then people will come to that system, and you have a major influx that sometimes the demand outweighs the capacity. In the midst of all this, you started being hit by COVID demand, which is uncertain. There is an exponential number of cases, critical care capacity with its highly complex, coordinated care that you need to take into consideration. And you're not really sure how much of this COVID demand is going to eat up out of your existing resources. And here comes the challenge of how to strike the right balance between accommodating the COVID demand and also addressing at least the emergency demand during the crisis time, and then having a good plan for the elective and the waitlist pool once the system decongests a little bit. So here the lesson number 3, which is the system resilience as a game-changing behavior. The adaptability of the system and the resilience is a key issue here in order to strike the balance between escalation and de-escalation. And we're really proud that all these activities have been CEO-led and corporate-led and driven by the corporate, given to the regions to work based on the regional dynamics to strike the balance between escalation and de-escalation of the services. There are a whole host of initiatives that are related to escalation, and a whole host of initiatives that are related to de-escalation that are implemented across the board. Some of them are work in progress, and some of them are actually fully accomplished, and that actually gave a power to the system. That's one aspect of looking at the system resilience. The other aspect is that you're talking about a new norm. So the world after COVID is not like the world before COVID. And one very good example of this is that we're meeting here with thousands of people that actually did not happen before, which is a leverage in the system. So we need to be really open-minded and innovative in order to adapt the new norms, to create the future and to build the future to be pandemic friendly, and to look into how much innovation we can invest in the system to accommodate the current and future demands. One of the very important lessons is that the public awareness and engagement can certainly empower or disempower your system. And we've seen it all. We've seen Europe, we've seen America, we've seen also regionally the neighboring countries, and also the Kingdom of Saudi Arabia responsiveness towards the COVID pandemic. Part of it is because of the success of the healthcare system, of course, But also a major component of this is that there has been an excellent public awareness and engagement that actually played a very important role to avoid any crash of the healthcare system. As we said, the healthcare system, and this is a very famous curve that has been distributed and circulated over the last 8 months, and I'm sure everybody is familiar with this. You have finite resources. So if you can blunt the curve by spacing out the time of infections that take place, then your system is gonna cruise safely through the pandemic. But if this is not the case, then problems can happen. And that's why a lot of investment has to go towards the public awareness and engagement so that they are team players and key components of the entire ecosystem. And that actually helped a lot. Even with less powerful healthcare system that we have, we have seen it. We have seen that very strong systems did not really survive very well, and other systems really navigated smoothly through the pandemic. And that tells you that there is always another version of the turtle and the rabbit story, that if you really have your tools all connected together, then you're likely to succeed and you're likely to sustain your success. The last lesson that I would like to share is that the leadership embracing science is a true drive to the success. And MNGHA has been always proving that with all its arms, whether we're talking about the health affairs service provision, KSAU, education and training, or KMARC with the research arm, that has been creating a perfect blend of what an excellent healthcare system should look like. So learned lessons have been accomplished, but there is also to be accomplished. We've learned that more investments are needed in frontline assets because the frontline is the real key asset and the driving force for a successful healthcare organization. Long-term transformation towards digital health and innovation is the way to go for a modern healthcare system. More investment in primary healthcare and public health, customer-centeredness. I would also add the public engagement through volunteering services and through awareness. These are all collectively would help to establish the current and the future healthcare system. I think these are, Dr. Ali, these are, and the group, these are the main reflections that I would like to share with you, and I'll be very happy to receive your questions and comments. But before I end, I'd like to utilize this opportunity to remember Dr. Shahid Abdeen, who was one of our primary healthcare physicians in Western region, who passed away in August 2020 because of COVID. He acquired it through the community, and he passed away because of sustaining severe COVID when he stayed in the ICU for some time, and he passed away later on. ندعو الله سبحانه وتعالى له بالرحمة والمغفرة, and this is a very important, to remember that we're all loyal to our employees. We're all one family, and we're definitely remember him for forever. And we pray that although he was the first victim, that he will be the last victim in MNGHA بإذن الله. شاكر ومقدر لكم ويعطيكم العافية.
Thank you so much, Abu Abdurrahman. Thank you so much for this wonderful presentation. Rahimallah, Dr. Shahid. We still have 5 minutes to discuss a couple of questions from audience. But one of the striking things in our system, Walillah alhamd, is the low infection rate, hospital-acquired COVID-19 infection among healthcare workers. Despite that, we cared for a lot of patients. We doubled our services for COVID-19 100 times, some areas 300, 400 times. So what did the system or the organization, Abu Abdurrahman, do to achieve this achievement, alhamdulillah?
Thank you, Mufad, for this great question. Actually, like you said, the rate of infection in healthcare workers has been very minimal, alhamdulillah. It will continue behaving like that. I think part of it is related to the frontliners themselves, and part of it is the system support. And it was very obvious that frontliners, healthcare providers, and all employees really took on their shoulders to abide by the precautions and the safety measures since the inception of COVID pandemic. No compromise on the safety measures. Whether we're talking about critical care areas, high-profile areas, high-risk areas, or even other areas in the supportive units. Everybody was tiptoeing during the COVID pandemic in order to take these measures. And this cannot happen without the support of the system. We have seen it in different areas where protective personal equipment was a real issue that compromised the safety of healthcare providers. In MNGHA and in the national healthcare system, it was a non-compromise area, and continuous supply chain. Although this was interrupted internationally, that was ensured to provide continuous supply of protective personal equipment across the units across MNGHA, with the help of the colleagues in operations and logistics regionally and the corporate level. Monitoring of this process has been a key factor to timely address any defect or gap in the safety. And that was actually a huge effort that was done by infection prevention control, by quality and patient safety, and by also different clinical units that are observing and monitoring the practice of safety precautions.
Great, and maybe similar to that we are really in MNGHA privileged to attract high caliber, capable, trained healthcare workers, and this is basically they're responsible, they're committed, they're adherent, they're compliant to the rules and regulations, and this is very, very amazing response. Dr. Abdul Mohsen, the last question in this discussion is part of the response to COVID is de-escalation and the new healthcare system, the new NGHA after COVID-19. Can you just in 1 or 2 minutes summarize these initiatives and where are we heading?
Thank you, Dr. Mohammed, for the excellent presentation, and thank you, Dr. Ali, for the opportunity. I believe de-escalation has a complex definition. We're not speaking only about a pandemic that will remain with us for unknown period. We're not speaking about a month or two or even a year. We're speaking for longer than that. So the coming months and years will involve a very delicate balance between escalation and de-escalation as you see the world moving into second waves. Some of the countries are experiencing their second waves consistently now. So we have to be very, very careful and very meticulous in our approach. We all have a vision that we will emerge stronger out of this pandemic, and we're emerging with a new system, as we saw with the distribution of His Excellency a month ago. So we're emerging with a different business model for running healthcare delivery. More of virtual care, more of utilization of technology, more of efficiency, more of ways that will help us meet with the growing demand, as well as deliver healthcare in a safer way, be able to slow down when the pandemic, God forbid, escalates in the region, and be able to scale back very rapidly. So that will be the challenge over the coming period. But having the talent that we have, the workforce that we have at that caliber, having the system and the infrastructure will enable us to go smoothly over that challenge.
Beautiful. Dr. Mohammed Zahrani, I know there are tons of success stories and in all regions. But the beautiful things about health system is saving lives. So can you share with us one of your the patient story that we shared before in Jeddah, and I'm sure there are many similar cases in Riyadh and Dammam and Al-Hassan and Al-Madina. Briefly, if you can just introduce or make a small introduction to that case, and then we'll play the video, and then we will conclude.
Sure. Thank you, Abu Fahad. Like you rightly said, inspiring stories are so many, and they're happening as we speak across the regions. And the story that is intended to be presented here is not actually to represent Western region alone, but to represent MNGHA responsiveness to the overall healthcare ecosystem in the kingdom, the beautiful outreach that was demonstrated across the region to help out, and the beauty of saving lives of this particular example, who is a colleague, an in Saudi colleague who is a physician, pregnant lady who was almost dying in one of the private hospitals in Jeddah on the maximum settings of the ICU of the ventilation because of the COVID severe illness, lack of other supportive services. So the system actually responded on a timely fashion across all the units, and that demonstrates how all components of the system move together to achieve one goal, to bring the patient on ECMO machine and help her out until she actually recovered fully and she returned back safely to work, and now she's enjoying her life and work and her baby as well. So that was just a gesture of how MNGHA, just to show an example, how MNGHA responded to this kind of scenario.
Beautiful. Let's see let's play the video. Are we going to have the video?
طبيعة شغلي في المستشفى في قسم العناية المكثفة، بشوف كل يوم حالات كوفيد وبراعي العيانين وكده. إن شاء الله إني أنا أتصاب نفسي بالكوفيد، وبدت معي الأعراض سخونة، تكسير في الجسم، صداع، ألم في المفاصل وضيق في التنفس، هو كان أكثر حاجة مؤلمة. وظهرت العينة موجبة، صورة الأشعة بدأت تحصل فيها تغيرات، اتنومت في المستشفى. بعد كده الأكسجين بدأ يقل ينزل معايا لحد ما خلاص قرروا إني تعمل لي عملية قيصرية طارئة، وأنا كنت حامل في الشهر الثامن، عشان لأنه الأكسجين طبعاً قلة الأكسجين هتأثر على الجنين. وفي نفس العملية حيعملوا لي تنويم كامل وتنفس صناعي.
طبعا الآن تقرر إجراء العملية القيصرية بشكل عاجل للمريضة ترتيل. طبعا أدخلت غرفة العمليات تنفس صناعي كامل، والحمد لله المنة تم إجراء العملية وإخراج الجنين وكان بصحة وعافية. اختبار الكورونا المستجد كوفيد 19 طلع سلبي ولله الحمد. الآن المشكلة رجعت للمريضة نفسها. المريضة عانت الآن من نقص حاد في الأكسجين في الدم بسبب مضاعفات الفيروس في الرئة. بكل الوسائل المتبعة من تنفس صناعي وأدوية فشلت في أن ترفع نسبة الأكسجين في الدم. في هذه المرحلة تم الاستعانة بخدمات الشؤون الصحية بوزارة الحرس الوطني في القطاع الغربي لتقييم الحالة وتقديم خدمات غير متوفرة في المستشفى الآخر، ومنها خدمة الإكمو. الصعوبة كانت كالتالي، وهنا جاء التحدي بالنسبة لسلامة المرضى. هل يتم نقل المريضة إلى مدينة الملك عبد العزيز الطبية في جدة عن طريق الإسعاف؟ وهذا فيه خطورة طبعا كان على حياتها، بحكم أن النقل ممكن يؤدي إلى نقص متزايد في الأكسجين، وبالتالي يكون فيه تأثير سلبي على الحياة. أو يخرج فريق طبي كامل لتقييم الحالة وتقديم الخدمة إذا لزمت الحاجة. وتم خروج فريق طبي كامل مكون من استشاري جراحة القلب دكتور هاني مفتي، أخصائي التروية القلبية الأستاذ عبد الرحمن السالمي، أخصائي العلاج التنفسي الأستاذ نايف حريب، وأخصائي الخدمات الإسعافية الأستاذ أحمد المالكي، والممرضة عناية مركزة شاولة، والطبيب أخصائي عناية مركزة الدكتور أحمد رخم. التقييم حصل للمريضة في المستشفى، والحاجة كانت ملحة لتركيب جهاز الإكمو، وتم التركيب لله الحمد للمنة، ونقل المريضة بشكل آمن لمدينة الملك عبد العزيز الطبية بجدة.
جهاز الإكمو أو ما يعرف بجهاز الأكسجين الغشائية خارج الجسم، يتم الاستعانة بهذا الجهاز في حال وجود فشل حاد في وظائف القلب أو الرئتين. يقوم الجهاز بأخذ الدم قليل الأكسجين، حيث يتم تشبيعه بالأكسجين وإعادته إلى المريض. لتقديم خدمة الإكمو بطريقة آمنة وخالية من المضاعفات، يستلزم وجود فريق مختص من أطباء وفنيين حاصلين على تدريب خاص، يكمن دورهم في تقييم الحالة وتركيب الجهاز ومتابعة المريض حتى التشافي بإذن الله.
تمتلك مدينة الملك عبد العزيز الطبية بالحرس الوطني بجدة على أجهزة إكمو من عام 2014، وتم عمل 9 عمليات السنة الماضية بنسبة نجاح 60%. ونمتلك أجهزة متقدمة وحديثة تساعد الفريق الطبي على معرفة المؤشرات الحيوية للمريض بشكل مستمر حفاظا على سلامته. شعارنا في مدينة الملك عبد العزيز الطبية بالحرس الوطني سلامة المريض أولا، وبتقديم خدمة مميزة وجودة رائعة.
That was amazing. Thank you so much for the team, and thank you for this great response. And the ultimate goal of any healthcare is to save lives. So inspiring. Dr. Muhammad, Dr. Abdul Mehsen, thank you so much for being with us. And I also wanted to thank His Excellency Dr. Bandar for staying around. Again, thank you for the organizing group from all the part of the systems, from quality and patient safety, from ISID, from postgrad, from from the university, and all people who contributed to this. Thank you for the audience. We have almost 2,000 people watching us today. We have tons of questions. I promise that we will go through them and try to address your concerns and communicate with you. It was a great day. So honored to be with you. Finally, you are, as a healthcare providers, the heart of the organization. And we cannot survive as an organization without you. Thank you so much, and have a great day and great weekend.
Thank you.
Thanks to everyone for attending.